Since Valentine's Day, we can't help but think of our hearts. February is National Heart Month, fitting since heart disease is the #1 killer of women. With today's medical technology, it's possible to detect heart disease before symptoms even begin, and many people do not realize that's an option, and it can be a real lifesaver. Here to talk more about that, we have a whole crew of people here. We're going to start here with Jadenella next to me, as long as Dr. Mortiza Nagavi. They are from SHAPE, which stands for Society for Heart Attack Prevention and Eradication. Also, Dr. Richard Lee with Methodist Willowbrook down here on the end. What we have here is one of my colleagues. You can take a look at her. She looks very hip and healthy, but this is the ideal woman who needs to be checked. It doesn't have to be somebody who looks like a typical person you might consider having a heart problem.
Right.
Exactly. Yeah.
Outward appearance really makes very little difference. Most of the risk factors are unindicated, even in regular routine checkups, and that's why SHAPE was created by Dr. Nagavi in the first place.
How did you come up with this?
Well, SHAPE is proudly rooted in Texas Medical Center. That's where I was at Texas Heart Institute and University of Texas. We basically look at patients coming to emergency room. A large number of them are not very obese. They don't have a lot of high cholesterol or high blood pressure. They're called borderline, but they end up having to be the one to get heart attack.
And that's where this test comes in. Let's go ahead and get this started.
So the test is identifying hidden plaques, either in your arteries, either in your carotid arteries or your coronary arteries. These two tests are what SHAPE, which is Society for Heart Attack Prevention and Eradication, recommends.
And this just looks like a typical ultrasound that women are used to getting on there when they get pregnant.
Yes, but a different probe is used for vascular. Basically, what we're looking at, we're looking for a plaque like this, and you can have all these three have no symptom. And this is what we call the death of an artery.
Now, if you have this going on inside of your body, does this mean a heart attack is coming?
It's coming, yes. You are certainly at risk of heart attack. And we find it, we can put you on treatment. There's no 911, nothing emergency, but you will be on the path to stabilize your disease and be free of heart attack.
Dr. Lee, is this something you offer to your patients?
Absolutely. We have this screening test that we offer to, we offered it yesterday at the Heart Lunch for Women at the Berry Center. Basically what we do is we put an ultrasound probe on the neck. We measure the thickness of the arterial wall, called the carotid intimal medial thickness. And that gives us a good idea as to how thick the artery is and what the risk factors for the patient would be.
And you can find this out in just a moment. I mean, you're already finished with this test.
Yes, it didn't even take more than 30 seconds. Her test is done, and David was able to capture the thickness of the carotid artery. The thicker is your artery, the higher is risk of having a future heart attack or stroke. And if you find plaque, that even doubles the risk or increases the risk. So she didn't even have to go to hospital or do anything invasive. Within a minute, we were able to get the results.
We can further delineate her risk factors if we know her total cholesterol, her HDL, and her LDL cholesterol as well.
We're almost out of time, so I quickly want to ask you guys, if someone wants to do this, how do they find out where to go?
The best thing is asking their physician. I mean, the SHAPE website we're getting the capability of putting in your zip code and pulling up doctors that participate, but the best thing is to ask your doctor if they can do a CIMT test, just a carotid artery.
There's a simple website, cardiohealthtest.com.
Okay.
Can take you to learn all about the test, what it is done, and on SHAPE Society, which is a Houston-based society, you can learn more about the test.
We'll put a link to that on our website. Finally, very, very quickly, you have an event coming up,
the 24th?
We do.
Thank you. The February 24th, Friday evening, we have the Shake It with SHAPE event. It's a dance party. It's going to be at the Omni Hotel Riverway. It's a great band. Again, tickets are available on our website, shapesociety.org.
We'll also put a link on our website. Thanks, gentlemen, and we'll find out her results quietly and secretly, because that's what HIPAA allows.